Go ahead.
Thanks, Jen. 6 former advisory board members from the Biden health transition wrote 3 opinion pieces in a medical article calling for a new pandemic strategy that sort of embraces living with the new normal of COVID being endemic. And they said previous claims that we've gained the upper hand, now look short-sighted, and we need to change our understanding of what success is and what kind of target we're looking at. Has the president been advised on whether it's likely that we will have to live with COVID in some form or another forever by his current team?
I have not had the opportunity. It's obviously been a busy day to read these articles. I'm happy to do that, and I don't believe the president has. I think I answered the question a little bit earlier. In terms of advice given by his health and medical experts, I'd really point you to them to ask them that question.
And just sort of following up on Darlene's question, does the president believe that COVID is here to stay?
Again, the president's goal is to defeat the virus. The president's focus and objective now is to save as many lives as possible. And we know what works. And we know that pushing more people, getting more people vaccinated, getting more people boosted, encouraging mask wearing, making sure schools have the resources they need to stay open and do that in a safe way. These are steps that work. It means surging capacity to communities that are hardest hit. It means opening federal testing sites around the country. There are a number of steps we're taking day to day to save more lives, reduce hospitalization, and that's what our focus is on.
The experts also wrote that vaccine mandates should be imposed more broadly, including for school children. Has the administration heard those concerns, and is that something that they're weighing? Are more mandates possible?
Well, those decisions related to schools, and I haven't read the articles and I'm happy to, but will always be up to local school districts in terms of what steps need to be taken. And some have taken some steps, some have not, but those will always be decisions up to local school districts.
And then the latest CDC data shows that the Omicron variant accounts for 95% of the country's cases right now. There's also data to show that 2 shots is ineffective at protecting against this variant. So what is the point of calling someone fully vaccinated with only that primary series of shots if the science is showing that that's not enough to protect them?
Well, Jackie, what the CDC is advising is for everyone to be up to date on their shots. That means if you're scheduled at that point to have a booster, you should get a booster. And that is true. That is how they conduct their guidance for basically any shot regimen for childhood diseases, measles, mumps, rubella, whatever it may be. But I would point you to them for more specifics on where they are on what fully vaccinated looks like. They've obviously just provided additional guidance.
Wouldn't there then, at some point, though, be sort of a gap between fully vaccinated and up to date? Just looking at the 2 definitions, if they're encouraging you to be up to date, and most people are eligible for shots if you're over the age of 5, or booster shots, at a certain point in time, given the waning protection of the primary series of vaccines and the need to get boosters in a shorter time period, won't there come a time where you're not really fully vaccinated anymore with just 2 shots?
Well, when by up to date, they're advising people if they're due for a booster, they should get a booster.